So please join me in welcoming our speaker, Mary Rose Corrigan.
Well, thank you for having me. And my presentation will probably not be about traditional health indicators of infant mortality and immunization rates, but hopefully you'll think outside the box a little bit in what we're doing in Dubuque. And at the end, I'd like to get some input from you if I could, so to think about some new health indicators we can have. So this is all about data. Public health, cities, counties are always struggling to get data, especially current data. And most of what we get comes from state and federal sources. And by the time we get it, it's usually several years old, which is fine for trend analysis, but it's not real time. And we always want the most up-to-the-minute data. So I'm going to talk a little bit about what we're doing in Dubuque as far as our sustainability platform and plan, and how we use health indicators for that, and how me as the public health person there is kind of trying to use some of this to my advantage. So a little bit of background on a couple of subjects. In 2006, our mayor signed the U.S. Conference of Mayors Climate Protection Agreement, and the mayor and city council identified sustainability and becoming a sustainable city as one of their top priorities. Well, what does that mean? They developed a vision statement kind of based on a tri-topic platform where Dubuque is a viable, livable, and equitable community. We embrace economic prosperity, social cultural vibrancy, and environmental integrity to create a sustainable legacy for generations to come. And I do have a handout you can have at the end that spells all that out, and it's also all available on our website. So we've done a lot of work in terms of getting citizen input on how are we going to define sustainability for Dubuque. We did a lot of presentations. We have a sustainability coordinator. I'm definitely not the lead person on this, and we did a lot of surveys. And the idea was to create a holistic approach and not just look at environmental sustainability type indicators. So, as I said, it's kind of based on three topics, one of which is social cultural vibrancy. And under each of these three topics, we developed, through community input, some principles. And they're listed here. They're under social cultural vibrancy. There's green buildings, healthy local foods, community knowledge, and reasonable mobility. And under the economic prosperity heading is regional economy, smart energy use, which you would expect, resource management, another one which would be expected, and community design. And under the environmental and ecological integrity topic, there is healthy air, both indoor and out, clean water, and native plants and animals. So under each of these indicators, we have developed, or under each of these principles, these topics, we've developed indicators. And as a matter of fact, in 2011, the city partnered with the University of Iowa and the College of Urban Planning. They have an Iowa Initiative of Sustainable Communities. And what the students did there and the college was help to develop our Sustainability Indicator Report, which is a collection of performance measures on best practices that would help us measure our success and progress toward achieving some of these goals. They looked at over 1,260 indicators from 44 measurement systems across the globe. And their first report came out, which included 61 indicators to measure progress. The students also made recommendations to address what they identified as gaps in our sustainability framework. And what do you think maybe one of the gaps was? Health. Yay! So in August, our city council adopted health and safety as the 12th sustainability principle. And this is after, 2 years of having these 11 sustainability principles. And it came upon the heels of not only this recommendation, but a group of kind of a grassroots collective group of health, wellness, and social energetic people from our local wellness coalition who went to the council wanting health and wellness to be a priority. So by identifying health and wellness on our sustainability platform, that was the first step in having health and kind of public health as a priority. Now, I don't know how many of your boards of supervisors or governing boards or whatever make goals and priorities every year, but public health has never made the top list in Dubuque. And so for this to be on the sustainability platform is it's kind of a big deal. So community health and safety, they kind of tagged along safety in there, which is fine. The goal of that principle is to have policies and engagement to ensure that all residents have access to healthy and safe lifestyle choices. So that's the backdrop for our sustainability platform. And now I'm going to talk about, there's a lot of indicators. Like I said, there's 61, and you can look at the full report on our sustainabledubuque.org website. But I'm going to pull out some of the ones that relate to public health and how our health department is using them. So one of the first ones is energy assistance. The number of households applying for energy assistance, through our weatherization programs and assistance programs for paying for electricity and gas bills. Does this directly affect health? Probably not directly, but indirectly, if people are staying warm or cool in the summer, it can definitely have an impact on their health. Another one is under smart resource use is water use. Now this one is pretty easy to get through our water department, since probably 99.9% of the people in the city of Dubuque are on public water supply. So we're just starting to develop, trends in water analysis, and probably be interesting to compare, what happens weather-wise from year to year as to how it affects water use. Another one under the green buildings category is the number of Energy Star and LEED certified buildings we have. And you can see these numbers are kind of low, but every time there's a recognition of a LEED certified or green building in Dubuque, they do get recognition. And so they're probably a snapshot of a lot going on, because a lot of people work towards that, but don't do the paperwork to get LEED certified, that kind of thing. And then the other thing we're trying to do with the indicators is compare Dubuque to cities and communities of similar size and makeup. And for a lot of the indicators, they picked Ames, Decatur, Illinois, Oshkosh, Wisconsin as similar sized communities to just have some comparisons. So, and you can see in this indicator, we're kind of ahead of the game there. Rental housing code violations. Many cities, including Dubuque, have rental housing inspections, which very much relate to health. And I'll talk about our Healthy Homes program specifically, but this looks just at a basic one of the number of housing code violations. Another one that we can use in some of our health promotion and wellness activities is our miles of bike and hike paths and sidewalks, and as a ratio to roads of miles. And as you can see, 0.06% or 1.25, the ratio is pretty small numbers, but again, it's a start, and we do compare ourselves to some other communities to show basically how we're doing. Now, to me, we've done a lot of bike paths and different things like that in the last few years, but we still got a long ways to go, even in comparison with community like Ames. We also track the percentage of households within a fourth of a mile of open space, for instance. One of your more traditional health indicators, I think they like these because they know our data is very good. And, in Iowa, why do we have such good lead data? Because it's reportable. And so we have very good numbers. This one is lead, or tested for blood lead testing before the age of 6, and this goes under our built environment. And also with lead poisoned children, and we know the Iowa Department of Public Health helps us create these stats in terms of birth cohorts, so children born in these years and how our incidence of lead poisoning is decreasing. So we have great data on lead, like a lot of us do here in Iowa. Healthy air, we're looking at the EPA Air Quality Index for Dubuque, the number of days of good air. I'm going to kind of run through some of these. We track radon, another one we can get through the state and EPA. This one is a little harder to get. The number of emergency department visits for asthma. We know asthma is not reportable. I don't know how many of you have ever gone to your doctor's office and said, can you give me the percentage of asthma? And there's how many ICD-9 codes for asthma. They don't want to give it out. Some of them are coded as restrictive airway disease or whatever. And so the best thing we can get is ED visits, and I think Megan mentioned a lot of the Iowa Hospital Association data. Our local hospital gets that data for us, and we're able to, just add up our two hospitals and see what kind of asthma visits we're getting in the ER, which, doesn't tell the total picture, but it does give us an idea as to the extent of our problem. And then we've also been able to calculate average cost per visit. And I'll show you how that's working with our Healthy Homes program later. Clean water, this is federal requirements, and one of the indicators is just the EPA drinking water violations. And so a lot of what Megan talked about is so true, in that we have a lot of data, but are we using it wisely? Are we interrelating the data? Are we connecting it? And Smarter Sustainable Dubuque, kind of an outcropping of our sustainability plan, is a unique public-private partnership between the City of Dubuque and IBM Research, and a part of our city's sustainable initiative. And it aims to achieve the environmental, economic, and social equity needs of residents in our platform. So through several initiatives, we've been piloting and implementing community-wide data collection in a number of areas, such as water and electricity usage, waste disposal, transportation, and most recently, health and wellness. So Smarter Sustainable Dubuque aims to provide residents with the information and tools they need to make smarter choices about resource consumption, or most recently, improving your health. And it also studies ways to engage citizens to look at their own data and potentially make changes based on what they see. So working with IBM, we've developed technologies to measure this. For instance, in the pilot, there was a pilot group of people that got smart water meters that measured a lot of information about your water usage. And it was so smart, it could tell when you had a leak. And this is an IBM slide. I did not create this. They're big thinkers up there. So anyway, they look at all these factors, a city in motion. They look at transportation data. For a while on my smartphone, I had a tracking system, completely anonymous, that monitored everywhere I went, whether I was biking, walking, riding a car, whatever, to determine common street patterns. And there was a bunch of volunteers that did that. Smart water meter analytics. Because of the smart water meter analytics, it went to a portal where each person could go on the computer, look at their water usage. And it also led to everybody in the city getting new water meters that were more, could track more data. These water meters could tell you when you had a leak, could tell you your peak usage times. With all those other things, waste, this technology has been developed and creating these data sets. Well, the big question is now, analytics and modeling, how do they all relate? And how can we continue to use them? And this is just a little synopsis of Smarter Sustainable Dubuque is designed to give people what they need so they can do what they want with reliable information specific to them. And eventually it'll save them money, resources, improve the local environment and local economy. So isn't that what we want to do with health also? I think someday that's what, we're talking about, linking electronic health records, and more we have access to our own health records. So that data is out there too. I told you we did a small Smarter Health and Wellness pilot this summer, and basically with IBM research, a little bit of advisement from Sue Curry here at the University of Iowa and our City of Dubuque, we, based on the sensing data I told you that I had on my smartphone, we recruited 70 volunteers to put this sensing data on their smartphone, and it would track walking, running, and it wouldn't track when they were exercising, like on an exercise bike or a treadmill, whatever. There was a portal where they could input their daily activity too. So it was designed to measure a person's physical activity, and then through their own personal portal, they could compare themselves to others and also receive messaging. Now, this is a pretty small sample, but what we did find is that when you send a message out to people with encouragement, there's a spike in physical activity. Not that seems pretty simple, but when you're using technologies and smartphones, you wonder if this kind of stuff is going to matter. But when people get individual messages, it seems to impact them. Here's a sample of what I call this citizen dashboard. And what the goal is to do is to create a dashboard where people can view all of their data, their water usage, perhaps their wellness. Now that we're doing smarter discards, which is that waste or garbage initiative, they could see how much waste they're recycling versus putting in the trash and different things like that. So this technology is up in the cloud with a Intelligence Operations Center. That's part of the partnership with IBM. So there's data that real people and real citizens can use. So what's next? I told you that we now have a health and safety principle. So we need to develop some health indicators for that. Now, as you can see from some of the things I just talked about, there are health kind of indicators sprinkled throughout. We don't call them health indicators, but people like you and me know they really do that. So we're going to look at some community input for those indicators, and I'd like to get some ideas from you today, if I could, on what some of those would be. And then also look at, what existing data do we have that's reliable? Do we want to make that data set part of our indicators, or do we want to go with some different kind of things that we don't normally do? Now, one of the things that's affecting, what we do with the future in terms of smarter health and wellness after our very small pilot is, how do we look at the relationship of all the data we have? This is another IBM slide, by the way. Because health is really an outcome of a lot of different things. And those of you who were at the Hansen lecture here in September, was anybody here at that? Good. That was Dr. Martin Sepulveda, and he actually is with IBM, head of worldwide health and research, and he received that award. And he talked a lot about data and systems and the interrelationship of all these systems and how it affects health. I'm very fortunate to be able to work with Martin and on our health and wellness initiative. But nature, mothers, families, communities, behaviors, it's all very complex, and it's a interrelated system of systems, like Martin says. And how does employment affect health? How does transportation affect health? There's a catastrophic impact on cost and competitiveness to employers and sustainability to governments and economies. To look at all these interrelationships, can we take data from all our smart city initiatives and use it to gain new insights form hypothesis? Can we, detecting a water leak through a smart meter, result in fewer asthma attacks for residents, since the mold created by the water leak was the asthma trigger for that resident? Which not only results in better health, but results in money saved from fewer healthcare visits to the ER, like I pointed out earlier. We're living in this age that the zip code determines your health, your housing can determine your health, your education level, your income, your knowledge, your job. And how does all this relate? So one of the other things where we're collecting data, and which may end up being part of our Smarter City initiative, is our Healthy Homes program and our Green and Healthy Homes initiative. I think they said Brian Haniff also was one of the founders of the Healthy Homes program. And we officially just started our Healthy Homes program a couple of years ago. And we're also on a national organization called Green and Healthy Homes Initiative. So these programs collect data on environmental factors in the home. And it's a little bit more than housing code violations. We look at it a little differently. So for example, how does inefficient or improper heating and cooling systems affect how often a resident seeks medical care or misses school or work? Could we look at those different data sets? How does the number of asthma attacks due to environmental triggers affect school attendance? And this is the kind of data we need, not how many healthy homes inspections we're doing. So it's kind of getting away from the bean counting mentality. So since we've been doing this data collection in Dubuque for a couple years now through our program, we thought, well, let's start compiling the data and see if it starts to mean anything, and also what it can do for our next grant application to HUD so we can keep getting funded. So, for instance, we looked at all of our violations and we found the 5 most common hazards found in Dubuque homes: damp and mold growth, electrical, lead paint, falls on stairs, or potential falls on stairs, and different positions of things in the home. And those are the percentage chance of the hazards. And then, because we're giving grants to people to repair these common hazards, let's figure out what the average cost per hazard is of these 5 most common. And no big surprise there, lead paint is the most costly, but look at the other ones. And the other thing this does is when you're looking for resources and funding opportunities, whether it's to HUD or to a philanthropic organization or another non-traditional health funding organization, you can say, if we spend, $900 on an electrical fix, that may prevent a fire, electrocution, or whatever. So you can kind of start to attach real, meaningful, everyday things like how much it costs to fix something to, the cost of either an asthma attack or a whole house fire. And it also helps with, planning the future program. And these are the 5 most common hazards that we've remediated in our current grant. So fire hazards, damp and mold, electrical, lead paint, and excess cold. And we really look at those weatherization issues, and it's part of the whole green and healthy thing, because when people spend less money on heat, perhaps they have more money to spend on food, healthcare, and some of the other basic things for children and families. And then this is just another way of looking at the highest average cost per unit to fix some of these things. I asked one of our inspectors to make me some graphs, and she kind of went nuts, so which is good. The other thing we have with our Healthy Homes program is we have a home advocate, which is kind of she's not employed by the city, she's employed by the community foundation, and so we have a partnership with them on this Green and Healthy Homes. And she's kind of the point person for the Healthy Homes and Lead program, especially when they're all in working on one house, kind of to help guide the resident and be the go-to person for the resident. But she's doing pre and post evaluation and remediation visits on these households and trying to obtain data sets to show, again, what our Healthy Homes program is doing, not just how many healthy homes inspections are we doing. So some of the things we want to track are days of missed work or school, mold presence or pest presence, and we're doing it, on assessment or when a Healthy Homes visit is done, when the inspectors go in, And then afterwards, after the work is done, the goal is to do between a 6-month and a 1-year follow-up with the families, where the home advocate goes in and basically does a very similar questionnaire that she did the first time, so she can get some evaluation data. Now, these numbers are pretty small because she has just started the follow-up visits. But you can see that after, mold is decreased, pests are decreased. Asthma treatment has dramatically decreased, and these stories about asthma are individually very compelling, but when you look at just even the small numbers of data on the number of asthma treatments that are necessary before and after a Healthy Homes intervention, it's pretty quite remarkable. And these are some of the other outcomes we're looking at: elevated lead level, allergy symptoms, respiratory, asthmatic, urgent care, ER visits. And I think after we work on, after our advocate starts compiling these data, we'll find some of those categories. We'll probably combine some of them and find the most meaningful. So anyway, in a nutshell, that's what we're doing with sustainability data in Dubuque and how I'm trying to capitalize on it in the public health world. And as we start working on our indicators for community health and safety, I'd be open to your suggestions on how we can frame those indicators and what would be good encompassing indicators to use. So, and I'd be happy to answer any questions you have. We have 5 minutes or so. Yeah.
That you were looking at
Mm-hmm.
versus growth.
Mm-hmm.
Des Moines in the last few years has strengthened. And there's a restriction. So 2 lanes, got 1 lane, considered lane.
Mm-hmm.
On the city streets. And is that something that you're looking at?
Yeah, and we have done that in a couple areas. We're this close to having a policy on complete streets, which is a big step, because that means anytime you do a street, you're going to make it, bike lanes, streets, pedestrian, all that kind of stuff. But we did it in a new development called our Millwork District, in a downtown district where there's not room for a separate bike lane, but they put the signs on the streets. Yep. And that is kind of, it won't be long before that will probably be a requirement of a lot of the federal transportation grants and money you get for development. So,
and I will say it's an upside and downside. But a lot of times you'll have bike lanes and
mm-hmm.
and then you have to.
Yes. Yeah.
People should never be on
Right. Yes.
all this dynamic mix going on to educate the public. A bicycle is illegal.
Right.
B, a pedestrian has the right of way on his sidewalk.
Mm-hmm.
And C, if it's a designated spot for you, please.
Right. And I think there's communities are all over the place on where they are in acceptability and learning curve. There's some communities with no sidewalks, so they got to take that step. And so it's creating that culture and understanding and mentality. And you're right. I think it's going to take a while, but it's going to be us different modes of transportation learning to work together. Anything else? You guys don't have any good indicators for me? Yeah, Chris.
I'm going to ask you just have a.
Okay. You don't have a hidden camera on me where my mayor's going to hear me.
Well, Dubuque is demonstrating very, very progressive approach to healthy and well.
Mm-hmm.
But in so doing, it's getting into a level of potential monitoring of
Mm-hmm.
that I think could be characterized as almost overwhelming. How do you respond to, how are the people that can look beyond the immediate bounce back, pushback to what it is you're trying to achieve? Strategize about how you get there. I
Right.
see this just being
The big brother thing, and I don't want you knowing what I do. There's a couple of things. First of all, the community knowledge. That was a principle, and so it's all about educating the community on sustainability, its importance, and our own model. And community engagement is, I mean, everybody's saying the word, everybody's doing it, and we kind of started it, back in '06 when we started this whole thing. You really got to work on that to get people to volunteer for this stuff. They are not jumping up and down and lining up in front of Best Buy at midnight to sign up for this. So you have to use a lot of tools and techniques to get, whether it was smarter water, electricity, transportation, whatever. Probably the health was the hardest, but we also had the lowest budget on it, which was zero, go figure. But you have to give incentives, education, have community cafes where you invite people to come in, because even though it's all technology, smartphone or computer, they want to know what's at the other end of this, troubleshoot, a lot of marketing. I mean, all of these, those pieces, all of these logos, and you notice that each of the indicators has its own little logo, that's health, and this is smarter health, it's a lot of marketing. And so, it does take a lot of community engagement and enticement to not only get people to volunteer, but then to stay with it. And I have a few of these, which you're welcome to take one, or it's also on our website, sustainabledubuque.org, of when they looked at the people who were using the electricity portal, the water portal, the levels of usage and engagement, high level, medium, low, in terms of their interest, if it made any behavior changes, if they kept using it, if they kept backing. So they went and, they found out like a third or high level, probably 10 to 15% are high level, third or half are in that middle section where, we look at it, we think it made us do some changes to our life, and the bottom level where they never looked at it. So they're also analyzing how much usage those portals get so they can, modify or use different strategies. Directly, I haven't heard about, Big Brother watching me kind of thing. I know people who, leaks have been detected are very thankful because they didn't know they had a toilet leak. And they can see huge spikes in water usage, during the day when they're all gone. What's going on here? Well, you got a water leak. So that was helpful. Does that answer your question?
I just think it's going to be continuing.
It is. And I think health is probably going to be the most challenging, or one of the most, because it's very individual, very, behavior driven. We'll try and attack it from the community environmental and policy standpoint. So like you all do, like we're trying to do, health and all policies, that kind of thing. Anything else? Yes. Oh, no, we weren't picked. So.
Sorry.
That's all right. I mean, we're actually okay with that.
And then the other question is,
I'm going to back up one thing on the blue zone thing. Even though we weren't selected as a blue zone, as an outcome of a community transformation grants, we do have a pretty solid wellness coalition formed, and Patrice Lambert, our county health director in the back there, she's part of that too. And that is going to be a great tool for moving forward on a lot of this stuff. Radon, we've been getting mini grants and things like that since state health department started giving them out, promoting testing and education. And radon kind of goes in waves a little bit. kind of fell off the headline screen for a few years, and the last 4 or 5 years it's been up there. So we promote testing, more education. Back in probably in the 90s, we tried to, probably a little too soon, get an ordinance passed that all new construction had to be radon resistant construction. And that came from our Environmental Stewardship Commission. So when it went to the city council, of course they didn't ask me anything. And so they did not vote for it. And I bet if we put that back on the platform today, it would probably happen. And I think a lot of that's happening anyway, but I think an ordinance provides some assurance for people that, their homes will be built that way. That would be the ideal, I think. Okay, thank you. And if you'd like just a sample of the indicator overview report, that's down here for your use.
Thank you. So let's have a round of applause.